that for sure doesn't help in trust in institutions. If some new pandemic, for example, happens, or any kind of emergency situation of international concerns, trust in institutions is very low. And what will happen in the future? Nobody will do as, maybe I'm wrong, what is about United States. I know in Croatia that people are not trusting institutions because of these lies during pandemic.
Yeah, so I think you bring up a great point, and I want to basically expand on your point a little bit. So one of the things people like Peter Marks was saying before he left was how the misinformation and disinformation was creating vaccine hesitancy. Now, I would say that he's completely wrong. I think it's the lack of truth and transparency and the lack of commitment to true science that has led to vaccine hesitancy. But I would argue in today's world, we're beyond healthcare, we're beyond vaccine hesitancy. We've moved on to something I call as healthcare hesitancy. When we relied on our federal health agencies so much, our healthcare organizations and our doctors to do the right thing for us during the pandemic, and they didn't often do the right thing. Why? Because the shots weren't safe and they weren't effective. Okay? We not only are vaccine hesitant at this point, the world is becoming healthcare hesitant, meaning we don't trust anybody when it comes to our healthcare. And is that right? It's unfortunate, but I can clearly see why it's occurring. So I think there's something much bigger going on than vaccine hesitancy. I call it healthcare hesitancy, and we just don't trust anyone. And that's sad. Remember the days of when the doctor was kind of the one that you could rely on to be honest with you. And who believes in that anymore? I don't. And I'm a physician, and I openly tell people I'm embarrassed. I am embarrassed to be a physician in today's world. Why? Because they're no longer scientists. They just do what they're told. They want to make as much money as they can. They don't follow science. They let corporate pencil pushers tell them how to take care of patients. And they don't have the guts to stand up, learn about science themselves, and stand up for their patients and be their patient advocate. They're not.
I have a question not only for the United States, for everybody, and for Croatia also. How is possible that so many doctors and scientists during pandemic knew what was happening and they were quiet? They were not standing out. They were not saying what's wrong. They were just quiet. And when you ask them personally, they said they want to keep their job.
That's sad. And again, in days past, again, I do think physicians deserve more respect because they were willing to do the right thing. But clearly they're not. And I also I want to tell you a little bit about, in my opinion, how healthcare has changed over the last couple of decades. When I first started practice, right about 2000, okay, the vast majority of orthopedic surgeons were independent, meaning they work for themselves. Okay, about 70% of physicians were independent. They worked for themselves. About 30% of physicians were employed, meaning they were working for a company. Now, move forward 20 some years, and those numbers have almost flipped. Okay, so the vast majority of physicians now are employed. They're employed by large corporations, and they basically do what they're told because they don't want to lose their jobs. They're no longer scientists. They are basically punch-a-clock employees. And I think that's a big part of the problem, and I really do. It's become healthcare today, and I can't speak for the Croatian system, but I think worldwide it's become a revenue-based corporate healthcare system.
That means corporate took over our healthcare and public health.